Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're helping infection preventionists and other healthcare professionals who are battling COVID-19. We're also looking at how COVID-19 might affect the future of healthcare and what that might mean for infection preventionists, which brings me to my guest, Rebecca Leach. Becky has a background as a nurse and has worked in epidemiology. She has been an infection preventionist for over 10 years and is a member of Infection Control Today's editorial advisory board. She currently works at a large healthcare system in Phoenix in an acute care setting. Thanks for joining us today, Becky.
Hi, nice to see you.
So what do you think? How will COVID-19 change the job infection preventionists do, or will it in any substantial way?
I think it will change a lot of what infection preventionists do on a daily basis going forward. Certainly it has in the immediate time and probably for the next, I would think, year or so. But going forward, I think one of the biggest changes will be more of a focus on emergency preparedness and biopreparedness in infection prevention. Right now, that's not one of our main focus of our job. It's more so on preventing hospital-acquired infections and other things like that, and hand hygiene. But I think really getting more involved in being prepared for outbreaks and pandemics will be something in the future we'll be doing a lot more of.
It's interesting you said that, because I just interviewed another healthcare expert who said that preparedness is going to become a big part of infection prevention's job now.
Yeah.
How do you see that playing out on the ground, like in the day-to-day?
I think part of the day-to-day, it will be more of bringing awareness to frontline staff. So a lot of our work is a lot of education of staff. Mostly we focus on preventing infections or transmission or keeping staff safe while they're working in healthcare facilities, but also kind of bringing around the idea of focusing on proper PPE use and thinking about patient isolation and the things that we've had to do a little bit differently for this pandemic that might become more of our everyday work environment, like separating out our patients by symptoms, when we don't have a diagnosis, thinking about visitor restrictions, just thinking about how we interact with our coworkers, and trying to limit any, keep our social distancing and those kinds of things at work, some of those kinds of things.
When you say how you would interact with your coworkers, how might that change?
I think what we've seen here in particular in my facilities has been a lot of not so much transmission from patient care, but more so between employees. So focusing on more how we are interacting away from the patients. So in our break rooms or in our office spaces or desks, and how we need to be aware of the important infection prevention tactics, even when we're not taking care of patients, because we can expose each other while we're at work too.
You think infection preventionists will have a larger say in how hospital systems are run, or even how hospitals are laid out, or how different departments or wards are laid out?
I think part of that, I think that's true, because part of our role already is involved in when there's new construction or redesign of spaces, and we should be involved in that. And part of that can be looking at how to redesign this space if we were to have an influx of patients or an outbreak. How would we set up our space so that we might have enough negative pressure rooms to take care of patients if it's a respiratory illness, those kinds of things. So I'm thinking that will become more of a important topic when we look at new building designs or how we redesign current spaces in the future as well.
When you talk about infection preventionists interacting with other healthcare professionals in the hospital system, who in particular will you become, I guess, for one of a better word, closer to, or work closer with?
I think one of the areas that we're going to work more closely with is our supply chain and logistics area. And that was something that we found where when it came to PPE supplies, disinfectant wipes, all these other supplies for patient care, we had to work very closely with our supply chain and look at all of our options and really keep track of it. I also think working with lab more closely will be important in the future, to understand testing modalities, understanding our abilities to test and interpreting those tests. So those are two areas where we've had some interactions with them, but I think it'll be more important in the future to really keep consistent relationships with those groups.
Have things already been set in motion to change the way infection prevention is done at your hospital? I mean, a permanent change as a result directly of COVID-19?
We haven't made any permanent changes in our team. We've talked about how going forward will we try to integrate the work that we're still doing for COVID response with the work that we were doing before for infection prevention, hospital-acquired infections, our surveillance, all of those things that we were doing on a daily basis before. How do we integrate these two things, and what kinds of things do we need to leave aside for the moment and focus on instead? But we haven't really made any permanent changes. We had a very strong group that was working on biopreparedness before coronavirus and all of this happened. So I think that was beneficial for us. And so we already had that group established, so that will continue to go forward. I think that group will become more prominent in the network as far as a committee that probably more people will want to be a part of, and you know, the information will probably be shared more broadly and more recognition for that group as far as importance and the work that they do.
Is COVID over? I mean, will there be a point where we can ever say it's over?
Yeah, I don't think it's over. I don't think it's going to go away. I think, you know, over time, as we see treatments or vaccines come through, then it'll change how we respond to it or think about it probably. But I think it's going to be here with us for a long time, if not forever. But I don't think it's going away.
And you and I talked prior about the balancing act that infection preventionists have to do with taking care of their fellow workers at the same time taking care of patients. And that balancing act's going to continue, I suppose, right?
Oh, for sure. I think so. And I think part of it too for infection prevention is understanding what's happening in our communities. Because as far as infection preventionists and working in, if you work in a hospital or a nursing home, what you've been trained in is kind of public health and basic epidemiology. And so, you know, you're probably one of the only people in your area that might understand when we see public health data being reported and that kind of thing, how it impacts your specific community and how to translate that data back to what you're doing in your facility or doing for patient care, or how it translates to your staff. So I think it's just going to increase that.
So are you talking about more cooperation between hospitals and local governments or state governments?
Yeah, for sure. I think that's part of it. And also just that, you know, a lot of infection prevention background is based on epidemiology and understanding the data that's reported, but also cooperation with our local health departments and public health authorities to really have unified responses. And so that we can all rely on each other, work together, and be able to provide the information that we all need to make the right decisions and support each other.
Is where you're at now, where you're at was nothing compared to what was going on in New York City, as you mentioned. So is it basically back to normal in the sense where you're working?
Well, somewhat. You know, we've reopened for elective procedures in the beginning of May when the governor allowed that to happen. And so we are seeing more of our kind of normal patients, I guess you would say. Elective surgeries were very important in the facility I work in. But we still have a lot of COVID patients too, especially in our network. So it's kind of a mix of both. We're still very much living COVID. We haven't lifted visitor restrictions. We're still doing a lot of testing and screening of patients. But, you know, we're trying to bring in some of that more normalcy as well to sort of balance it out.
I remember last time we talked, and because of technical difficulties on my end, we never got your answer, but it was a great answer. And As I said, I usually ask people what's their worst day. I asked you, I asked you what was your best day during this. Do you recall how you responded to that?
Oh yeah, I think the best day was the day that our first patient with COVID-19 was discharged to home, had tested negative and was discharged and was able to go home. And that was one of our best days because it kind of felt like triumph. And the patient had been here for a very long time, several weeks, and it was just a good thing to see it. And I think it was good for all of us who'd been preparing and working on it to see a success story like that. That was a good day.
It was a touch and go for that particular patient?
He was on the ventilator. He was in the ICU for a very long time. It was touch and go. And then he was finally well enough to get off the ventilator and moved down to our med surg floor. And he was there for a long time as well, just getting basically rehabilitated and getting his strength up. And then, we couldn't get him discharged to a long-term care facility at the time. So he kind of just had to do all of his almost post-acute rehab in the hospital. And so then he was finally able to go home.
Did the hospital staff give him a nice send-off of some sort?
I think everybody was, sort of cheering and sort of happy to walk him out. We didn't do a big, parade or anything, but there was a lot of good positive sentiment around it. And I think it really helped the staff that were working on our COVID cohort unit to see a kind of a happy ending and outcome for this patient.
I imagine so, because I'm not, you hear these stories a lot about COVID patients sadly having to die without loved ones near them because they can't let the loved ones near them because of how contagious the disease is. And I guess when you have a nice memory like you just related, that kind of softens some of those bad ones.
Right. I mean, we have, our share of the sad stories too. But yeah, you try to focus on the positive ones that come out, and there's more positive than bad. So that's a good thing.
So any final advice for your fellow infection preventionists about how to face the future?
I think this is a really interesting time to be in our field. We are definitely being pushed to our limits of our jobs and what we do and what we're passionate about. So I think if we have a chance to sit back and really take it in and absorb what we're doing right now, we are kind of living in a historical moment, and our jobs are very important and very pivotal right now. And so I think if you have a chance to stop and just think about that, it makes you feel very proud for what we do. And this is why we've been doing what we do forever. So I think we all just need to be proud of what we do and support each other, and try not to lose faith and just keep going and be strong.
Words of wisdom from Rebecca Leach, member of Infection Control's Editorial Advisory Board. Infection Control Today's Editorial Advisory Board. Thank you for joining us today, Becky.
Thank you.